While it's common for care providers to push certain interventions during any vaginal birth, this can especially be true during a VBAC. I've had many moms that I've supported through VBACs have tons of interventions suggested to them, and they really had to advocate for themselves, at least regarding those interventions they didn't feel were medically necessary. Luckily, there are a lot of ways to help to avoid unnecessary interventions. And I'm also going to go over some specific interventions you want to avoid whenever possible, specifically during a VBAC. So one of the first things is to take a childbirth prep class in the hospital that you'll be delivering in and outside of the hospital. So the course that you take in the hospital can be so helpful because it will give you a pretty in-depth understanding of the culture in that hospital and certain interventions that they might try to push on you. So this is really valuable information. Then you can take a class like hypnobirthing, birthing from within, Lamaze, the online course that I have on Udemy, the Childbirth Preparation, a complete guide. And these courses can then help you develop strategies for minimizing your chances of needing intervention. You know, it teaches relaxation techniques, ideas for how to advocate for yourself, you know, so you really go into birth with, you know, a lot of knowledge about what to expect from the hospital and how to navigate it in a really savvy way. All right, next, if you are nearing your due date and your care provider is like really encouraging you to induce, something that you can do is ask to have regular non-stress tests. So number one, with a VBAC, we really want to avoid induction medication because this does increase the chance of a uterine rupture. So it's even more important to avoid induction whenever possible when trying for a VBAC. And so with a non-stress test, this is a type of test that can sometimes be done at the doctor's office. Sometimes you have to go into the hospital for it. And it's a type of monitoring that involves monitoring your blood pressure. It's taken at regular intervals when you're sitting in kind of like a reclining position or laying in a reclining position. And then your baby's heart rate will also be consistently monitored during this time. And what the test is really looking at is what the baby's heart rate does when the baby is active. So if the baby is really still, then the care provider will probably try to get baby to start moving around so they can get an accurate read. And this test can be a game changer because it helps to confirm the baby's health, which can ideally buy you some more time. It can help to encourage your care provider to stop pushing induction so much. Okay, next, don't go to the hospital too early because if you go to the hospital, say when you're only like 2 or 3 centimeters, which of course, you know, it's hard to know or it's impossible to know how dilated you are unless you have somebody actually check you, and I'll get into when it's probably best to go. But if you go too early, then you're more likely to have the care providers say, well, you know, your contractions aren't that strong. They're pretty spaced out. We can get things going by inducing you. And again, we really want to avoid induction. So what a lot of care providers go by in regards to, you know, when a woman should come into the hospital is the 4-1-1 rule. So this means that you have been having contractions that are regularly about 4 minutes apart or closer. That each contraction lasts at least a minute, and that you have been following this pattern for at least an hour. So again, the 4-1-1 rule. And another good sign that you're like eking into more active labor, that you might be getting closer to being ready to go to the hospital, is that you cannot talk through contractions, that you really need to concentrate. You have to really breathe. You can't be like cooking an omelet and having a contraction. That probably means you're not ready to go into the hospital yet. Okay, and then Next, during labor, if an intervention is being proposed, not because of a medical emergency, keep asking questions until you feel like you have all of the relevant information. So, for example, if the doctor recommends that you induce, because you're progressing really slowly, maybe your contractions have spaced out or they're a little bit less intense, ask why they think induction is medically necessary, and ask if your baby is showing signs of distress, if your health seems tenuous, ask if it would be dangerous to not induce at this time. Ask what the alternatives to induction would be. So essentially just keep asking questions until you feel like you have the full picture. And then after discussing the options with your partner or your doula, if you have one, make the decision that feels intuitively right for you. Next, try to be patient. I know this is a hard one. If you've never had a vaginal birth before, it can take a while. So try to just focus on, one contraction at a time instead of getting distracted by, how many contractions you have had, how many more you think you need to have, because of course, nobody knows the answer to that question. So just try to focus on one contraction at a time. And then finally, create birth preferences. This can really support you in having care providers back off on pushing certain interventions on you if you clearly state in your birth preferences, look, I don't want you to offer X, Y, and Z unless it is absolutely medically necessary. So for example, if you want an epidural, but you don't want Pitocin, you can write that in your birth preferences. Say, yes, as soon as I can get it, I want that epidural, but I do not want Pitocin, again, unless it is absolutely medically necessary. And you can also add anything else that you feel would be important to you during your birth experience. And after creating these preferences, I recommend bringing them to a prenatal appointment with your care provider in the 3rd trimester so you can go over each one together. And I have birth preferences template at the end of this lesson that you can work off of. But of course, make it your own. Take out anything that's not important to you, add anything that is. With all that said, it's also really important to go into birth with an open mind. A lot of times our birth doesn't play out exactly how we had it written down in those, birth preferences, which is sometimes called a birth plan. It's impossible to know exactly how your birth will unfold. So it's best if you're willing to be flexible with your preferences, if your medical circumstances do shift during labor. Okay, and so now I want to go over just a few of the specific interventions it is best to avoid during a VBAC. So, I've talked about induction a lot. Whenever possible, we want to avoid induction medication because that can increase the chance of having a uterine rupture. You also want to avoid internal monitoring of contraction pressure. And so this is not the same thing as internal monitoring of the baby's heart rate. This is different. So some people believe that if your C-section scar ruptures, internal contraction monitoring will alert your care provider to this because the contraction pressure will drop. But studies have actually shown that this isn't the case, and having this type of internal monitoring can actually increase the risk of a uterine infection, and it can severely limit your ability to move around during labor. So again, we want to avoid, whenever possible, internal monitoring of contraction pressure. We also want to avoid a routine IV drip. So if the hospital requires an IV line, what you can ask for is like a heparin lock or a saline lock. And what this is the IV needle is inserted, usually like around your wrist, with a short piece of tubing attached to it, and heparin or saline to keep the blood from clotting. And so you have an open vein, but you're not actually attached to, the IV stand. And so you have this open vein. So if they do need to attach you to an IV for, a medical reason, they can quickly do so, but you're not constantly having to drag around the thing before that happens. So you have that open vein, but you're not constantly attached to an IV unless it becomes medically necessary. And then finally, you want to avoid routine internal examination of the uterine scar after the vaginal birth. This can be really, really uncomfortable for a woman that doesn't have an epidural, and it could introduce infection. All right, so go ahead and download that birth preferences template, start working on that, and start looking for a good childbirth prep class that you can take after you take that hospital childbirth prep class.